Okay, so here's a view of my entire room for my cardiac assessment, and here's this side of that wall, and then there. And so today during my cardiac assessment, I would first perform hand hygiene and put on gloves. And the first step of this assessment is going to be inspection. So if I could have you stand up, and I would inspect the aortic area, which is the second intercostal space down, and then I would move to the pulmonary area, pulmonic area, and then the mid precordial area, and then the mitral and tricuspid space. And for that, I would be looking at pulsations that I could see, and then the next step is going to be palpation. So I'll use my index finger and my middle finger and my dominant hand, and I would be feeling on the aortic area for any pulsations, and then the pulmonic, and then the mid precordial area, and then the mitral and tricuspid area. Okay, and then after that, I would be palpating with the palmar surface of my hand where my fingers and palm meet, and I would be feeling for any thrills or heaves. So thrills would be, and I would be palpating in all the same spots I did before, the 5 same spots. So the aortic, and then the pulmonic, and the mid precordial, and then the tricuspid and mitral. Okay, and then the thrills would sound something like a purr, and the heaves would be any abnormal uprising of the chest or that area. So, and then I'm going to auscultate, and I will be listening in those same 5 spots. And I would be using the diaphragm first, and then I'll be using the bell. So I'll be listening for the S1 and S2 waves, and I'll be listening for any abnormal sounds like weaving. No, that's not what I'm trying to say. Or S4 waves. And then I did the aortic, pulmonic, and then mid precordial, and then the tricuspid and mitral. And then I'll go on and do that with the bell. Okay, and then after that, I will be checking for peripheral pulse sites. So if I could have you, before that, I will be looking at her jugular vein. So if I can have you sit down in a Fowler's position, which is 30 to 40 degrees, so just kind of, yes. And I'll be looking at her neck, left and right sides for the symmetry and volume. So I'm looking for if there's any volume overload. Okay, and then next thing I'm going to do are check peripheral sites. So I'm going to be checking the temporal, carotid, the brachial, radial, and then the brachial beneath her knee, and the palmar duralis, and then the not femoral. can't remember which this one is called, but I'll be checking that one too. So I'm going to first, just like, okay, you can just lay your head down casually. So I'll be checking the temporal, and I'll be using my dominant hand for both sides. And then I'll be using the symmetry, for checking symmetry, I'll use both hands. And if it's a normal rate, I'm going to only feel for 30 seconds, but if it's abnormal, I would check like in a regular beat, I would check for a full minute. Okay. Then I would check the other side. Okay, and now I'll check for the symmetry. Okay. And then the next site I'm going to check is the carotid. And then the other side. Okay, and now I'm going to be feeling for the symmetry. And when I feel these pulse sites, I'm looking for rate, pattern, volume. Okay, and then I'm moving on to the brachial. So I'm gonna have you pull your sleeve up. All the way. I just need for the brachial side. Okay. Okay. I'll do it. Stop. Just kind of flex your palm like this, and you can land. Oh my god. Okay, and I'm going to be feeling for 30 seconds. Okay, and then I'll check the other side. And I'll feel for another 30 seconds. Okay, and now I'm going to be checking for the symmetry. So I'm going for another 30 seconds. Okay, and now I'm going to be checking the radial. Okay, the pulse. That's what I've been doing this entire time. Here it is. Okay, and then I'm going to check the other. Okay, and now I'm going to be checking for symmetry. Okay, and now I'm going to move on to the brachial site and then the sites on the lower. I'll move down my camera so you can see that. Okay, can you just lift your, no, actually stay laying down. I just need you to lift your pant leg. And I'm going to feel the pulse site there for 30 seconds. Okay, and now I'm going to do that on the other leg. For 30 seconds. Okay, and then I'm going to look for the symmetry of those. Okay, and then I'm going to lower these socks off so I can check your pulse heights here. So first I'm going to be checking the pulse height right here, and I'll be doing that for 30 seconds. Okay, and then the next foot. Okay, and now I'm going to be checking for symmetry. Okay, and now I'm going to find my last pulse height, the dorsal. Okay, and now I'm going to move on to the other foot. Okay, so I found that pulse height, so now we're just checking the symmetry of those. Okay, and now that completes my cardiac exam.